Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Tinea Capitis, also known as scalp ringworm, is a common fungal infection that affects the scalp. It's highly contagious, especially among children. Despite its name, it has nothing to do with worms. It's caused by a fungus that thrives in warm, moist environments. Tinea Capitis appears as itchy, red, scaly patches on the scalp. It can cause hair loss in the affected areas, making it quite bothersome. However, the good news is that Tinea Capitis is treatable with antifungal medications. Understanding the causes, symptoms, and treatment options is crucial for effectively managing this infection. By taking preventative measures, you can minimize the risk of contracting or spreading Tinea Capitis. Let's delve deeper into the details of this common scalp condition. Tinea Capitis is caused by a type of fungus called a dermatophyte. These fungi feed on keratin, a protein found in hair, skin, and nails. Dermatophytes thrive in warm, moist environments, making the scalp an ideal breeding ground. The infection can spread through direct contact with an infected person or animal. Sharing combs, brushes, hats, or pillows can also transmit the fungus. Even contact with contaminated surfaces like gym mats or shower floors can lead to infection. Children are particularly susceptible to Tinea Capitis due to their close contact with others and their developing immune systems. However, people of all ages can get it, especially those with weakened immune systems or underlying medical conditions. Tinea Capitis typically presents with noticeable symptoms on the scalp. One of the most common signs is itchy, red, scaly patches on the scalp. These patches may be circular or irregular in shape and may gradually increase in size over time. Hair loss is another characteristic symptom of Tinea Capitis. The infection weakens the hair shafts, causing them to break off easily, resulting in bald patches on the scalp. These patches may be smooth or studded with black dots, which are remnants of broken hair. In some cases, Tinea Capitis can cause swollen lymph nodes in the neck. This is the body's natural response to fighting off the infection. If you experience any of these symptoms, it's essential to consult a healthcare professional for proper diagnosis and treatment. Section 4. Diagnosing Tinea Capitis. A trip to the doctor. Diagnosing Tinea Capitis usually involves a physical examination of the scalp and a review of your medical history. Your doctor will examine the affected areas for characteristic signs such as scaly patches, hair loss, and inflammation. To confirm the diagnosis, your doctor may take a sample of the infected skin or hair for microscopic examination. This involves examining the sample under a microscope to identify the presence of the fungus. In some cases, a special light called a Wood's lamp may be used to examine the scalp. This lamp emits ultraviolet light, which causes certain types of fungi to fluoresce, making them easier to identify. Section 5. Treatment options. Getting rid of scalp ringworm. Treating Tinea Capitis typically involves oral antifungal medications prescribed by a doctor. These medications work by inhibiting the growth of the fungus, allowing the infection to clear up. The duration of treatment varies depending on the severity of the infection, but usually lasts for several weeks. It's crucial to complete the full course of medication as prescribed, even if the symptoms improve sooner. In addition to oral medications, your doctor may recommend antifungal shampoos or creams to apply to the scalp. These topical treatments can help to reduce the spread of the infection and alleviate symptoms like itching and scaling. Section 6. Preventing Tinea Capitis. Tips for a healthy scalp. Preventing Tinea Capitis involves adopting good hygiene practices and avoiding contact with infected individuals or objects. Regularly washing your hair with an antifungal shampoo can help to keep the scalp clean and free of fungus. Avoid sharing personal items that come into contact with the scalp, such as combs, brushes, hats, and pillows. It's also essential to keep your hair and scalp clean and dry, as moist environments promote fungal growth. If you have pets, have them checked regularly by a veterinarian for ringworm, as they can transmit the infection to humans. By following these simple preventative measures, you can significantly reduce the risk of contracting or spreading Tinea Capitis. UMCC, your ultimate medical consultant connector.